So can you see my slide share?
Yes.
Yes, doctor.
So today lymphoma plus, and we'll continue stem bleeding disorder. So lymphoma is quite short, just 30 slides only. So lymphoma, so you need to know at least normal lymph node architecture, then lymph node. This is lymph node pathology. Then black lymphoma, normal lymph node need to know causes of lymph node enlargement. Can be caused by, I think everybody has suffered lymph node enlargement due to inflammation, I think, right? After you suffer pain on your lower injury at your limbs or your in your mouth, you can feel lymph node enlargement. I think everybody has suffered lymphadenitis. Hi, can you hear?
Yep. Yep.
Can be metastasis also. So in another one. I think I will do before lecture. I want to ask your opinion before. I think Friday. This Friday, you have MBU or not? This Friday. I think I need to
We
do.
haven't.
You have MBU or not this Friday?
Yes,
You have
doctor, we
MBU.
have you.
MBU in morning or evening?
10 to 12.
And Friday. Can you do MBU? Okay, or Friday afternoon? I need to check with Dr. Shana. You wanna do online exam? Online exam, but I think some student very difficult in connection, right? Online exam with timing. If I fix timing, if you cannot finish, you lose your maths only.
Yes, doctor, internet connection is a problem, the speed.
Yeah, if you have connection problem, and quite difficult to do in online. Just I need to choose the method. I need to present. If you, I wanna know all student connection. If you are connection not good, if I give a time like one MCQ by 40 seconds, if after 40 seconds the question already will not come back again, already finish, and then after 1 hour or everything submitted your marks. So if you cannot do second time, if you have connection loss, you cannot do second time also. Your mark already keyed in automatically. So your connection slow, you have got lost marks or you are delayed. This is the problem. How about your connection? How many students got connection problem? I wanna know.
I do have connection problem.
You can WhatsApp me. We can WhatsApp me the list who have connection problem so that I can present the Dr. Jaga. Because I can choose the method. If your connection is really slow, I can choose another method. Because if I use timing, if your connection not good, you cannot answer. If your assignment is delayed, if after like MOC, MCQ only 30 minutes, after 30 minutes everything finished. If you cannot, I'm gonna say, if you cannot cope because of connection problem online, you you lose your marks only. So how about your connection? How many students? And a lot or some only?
Sorry?
How many students have connection problem?
I do.
You and
Doctor, I think
another
we
one
have connection problem.
connection problem. Another one who also have. I wanna. So your line is not stable, right?
Yes,
Your
doctor.
connection not stable. So I need to just give me some list of connection problems so that I can show. Then I can choose another method because of connection. If one or two online connection should be all unique at the same timing. Otherwise, you will lose your marks only. You cannot answer only. So make sure your connection is not stable or not good. Can inform me your list at the pathology group so that I can do the links and I can show the debuting for their problems. So data, right? So so another who problem, five problem or not? fact, you have problem, no? Pen is okay, I think. Pen ocean. Are you
Yes,
okay?
sir. I do
Your
have
condition is
problem.
okay. Your condition okay. Another who problem? Who hand? Where's who hand? Who hand is okay or not? G. G also okay or not? Another one, Tanusha. Tanusha, Melissa. Melissa not here.
Doctor, we are creating a list in WhatsApp.
Yeah? Yeah.
We are creating a list in
Yeah.
WhatsApp, doctor.
Yeah. Please send me list today so that maybe on Friday I need to do exam, maybe online or not. I'm not sure. Depends on. I need to decide also. I need to wait for management decision. I need to present how many students have connection problem so that we can choose another method or something.
Okay, doctor.
So okay, I will. Please send me the list. If your connection problem you have, please give me. Otherwise, you not give in the list. If I give, you cannot any complain if you cannot answer on time during time limit. If so, please give me the list if to ensure your connection could or not. Okay, I will continue your my lecture. Please give me the list. What's up?
The list go like.
Mock test here, maybe Kahoot. I'm not sure what method I have to use. I can check with Dr. Shanes and Dr. Jega. Kahoot, if you have if Kahoot is time limit present, that online test, I don't know what method I have to use also. They suggest for Kahoot or Microsoft also they have assignment. I need to test and then we can do for mock test or but they need to do decision also. Another thing I can choose another some student like Bella or something, I forgot her name. She have no connection error. She tell me very slow. So like the student, I need to do repeat again. MOC cannot possible. So I can do mock text later. I try to do, but I think even 4 or 5 students have problem. I cannot do also because not fair. If question not the same, not fair for them also. Right. If question not the same, not fair for anyone. So let me just give me the list first. If you now too many lecture, you have 10. So I think most of you already know your connection is stable or not. Good or not. If you have no stable, frequently you need to report. If you have sometimes only or 1 to 2 times only, quite okay. If you frequently got problem, you need to report. Otherwise, I need to decide how many percent and what question type I should choose. Because I need to wait for management decision also. So I can present this. They have how many students have problems, so we can choose another alternative way like this. Okay. I'm going to try for test also. I think that some students around about 3 or 4 they already send me every time message. They have connection problem. They cannot join. So lymphoma. So metastasis. So in neoplasia, how many types? How many ways of metastasis? How third way of metastasis? How many? How many? So anyone? Can you understand my question, right? Metastasis. This is lymph node is one of the metastasis area. Another organ. This can cause frequently metastasis. Lymph node is one of common site for metastasis. Another common organ for metastasis. You must know another 3 organ. Anyone? Oh, I will call the name. Wuhan.
Yes.
So other organs in the body, brain or liver or spleen or intestine, what organs are common site for metastasis? Lymph node is one of the organ that common for metastasis. You understand metastasis, right? Metastasis.
Yes, doctor.
to another organ mean what organ? Brain, liver, and bone, intestine, pancreas, bone marrow. What organ are common site for metastasis? For example, if you suffer tumor in intestine,
lungs, doctor.
Lungs, correct. Another two common organ. Can answer anyone? Liver is okay. Another one. Liver. Bone is correct. Not blood. Bone is correct. Bone is correct. Another one. Another organ. Still one organ. Important organ still missing.
Lungs.
You say lungs correct.
Brain.
Bone correct. Brain, yeah, brain also
Brain.
correct. Another one, liver. Liver also very common. Even liver is more common than brain. So lymphoma is benign or malignant. That is benign or malignant. Lymphoma is benign or malignant.
Benign.
Who? Shan. Sure, benign.
Benign.
Benign. Why benign? Who are benign and who are malignant? Anyone who want to tell malignant? Shan is benign. Another one. Where? Melissa. Melissa not attending today. Pan or Shan? Pan, you are benign or malignant?
Benign.
Benign.
Another people who still C is benign or malignant?
Benign.
Oh my god. Lymphoma is malignant. Exception.
Yes, sir.
Oh, the misnomer, doctor. Sorry.
Exception. Some exception. Anyway,
Oh.
some is you should know this exception.
Oh.
MC2 point. Even anyway, they are malignant. Hodgkin, they are malignant. Anyway, another, there are some exception. Even anyway, some name are malignant. Lymphoma is malignant. We consider Hodgkin is non-Hodgkin. The Hodgkin scientist name. He identified this type of lymphoma and then lymphoma is malignant. We can consider lymphoma malignant. I'm telling you about this is lymph node cancer, actually. So this you can learn from lymph node normal histology or capsule. You should identify the capsule first. This is capsule, lymph node capsule, because in metastasis, for example, metastasis of cancer from other organ, they can invasion, they can penetrate from this capsule. So you need to identify this capsule is normal or not. If this is in lymph node origin, this inside changes will occur first. Medulla, follicle, follicle, sinus, capsule. This is paracortex. You should know this normal histology and anatomy. Germinal center, then malignant. Why you lymphoma is benign? It's very should not be wrong. This must know. So lymphoma is malignant because you try not to confuse. In MCQ favoring point, what tumor is malignant? And we give lymphoma, melanoma, like this, lipoma. Benign can be non-specific reactive hyperplasia, reaction caused by infection, cancer, or threat. This can cause reaction inside the lymph node and can cause lymph node hyperplasia. And some specific reactive Hyperplasia is just infection, mainly caused by some infection. May be caused by secondary neoplasm, also malignant. 2. Primary lymph node tumor is lymphoma. Another one is leukemia, but usually we call lymphoma. Leukemia is if origin from lymph node and then metastasis to bone marrow and can create leukemia, and sometimes can change and sometimes also. So sometimes these two terms are sometimes overlap. If origin of lymph node, we call lymphoma. Origin of bone marrow, we call leukemia. So firstly, most common is reactive lymphadenitis. In clinical, we can see everybody have suffered lymphadenitis, commonly caused by infection. So lymphadenitis and lymphadenopathy, you should care of point is painful or painless. It's care of point. Cancers usually painless. If lymphoma, if you, I think everybody have suffered inflammation or lymph in your body due to injury or infection. If usually, I think your lymphadenitis is almost always painful due to inflammation or infection. If you have painless lymph node enlargement, you should suspect cancer. Or sometimes TB, tuberculosis. TB also not painful. So lymphoma means cancer in immune system develops from lymphocyte in lymph node, spleen, thymus, bone marrow. So lymphoma, what is lymphoma? Malignant neoplasm of lymphoid tissue. Site, what area? Mainly lymph node. Extranodal lymphoid tissue is GI tract, spleen, tonsil. Lymphoma, you should know nodal and extranodal. Nodal means inside the lymph node is called nodal. Extranodal lymphoid tissue. If lymphoma occurs in GI, spleen, tonsil, we call extranodal. It's 3.7%. You should know a malignant neoplasm of lymphoid tissue, not benign. Even anyway, OMA, this is malignant. Two types: Hodgkin, non-Hodgkin. Hodgkin lymphoma have ISL, non-Hodgkin. I will explain ISL later. Non-Hodgkin, no ISL. This is ISL, disturbance. Big malignancy is normal lymphocyte. Big cell with nucleus mirror image each other. Is Hodgkin lymphoma. For your level, at least you should know Hodgkin lymphoma. Non-Hodgkin lymphoma is too much complicated. If you must know at least Hodgkin lymphoma for your undergrad level. Malignant characterized by tumor giant cell in return disturbance. Disturbance, even this scientific, you have the pathology textbook. You can, if you wanna read, you can buy disturbance pathology books. Quite expensive, around about more than 2,000 ringgit, something there. This textbook is for not for postgrad level. If you wanna read for more detail than Robin, you can read disturbance pathology books. This is scientist name. He have textbooks, pathology textbook. They have disturbance, but quite expensive. Even I only have soft copy only. I don't have hard copy. Quite expensive. %10 of lymphoma in Malaysia is Hodgkin. What is bimodal? Anyone who is bimodal? You need to know the term. What is bimodal? Bimodal H mean what means? J, where is J? Today J is missing. How about where Fazin? Passing missing again.
Doctor, it means 2 ways, right? 2 age groups, is it?
Bimodal mean 2?
2 common age groups, in fact.
Yeah, age group. Bimodal.
It could be around 20 years old, and then the second peaks around 50 years old.
Yeah, bimodal mean bimodal mean you can be young ages around about less than 20 or children. Then another age group can be elderly and younger, very younger, maybe children also. So this for bimodal incidence mean this common. Not only some is common in elderly, some common in younger. Now this is common in not middle. This is younger plus older, not middle age. Usually common in younger, 20, 70, less than 20 means 50, 60 common. Then another after 16, 70 common. Middle age 30, 40, 40, 50, not that too common like this. It's bimodal. Maybe involve single limb or chain pattern. This you need to know this then. Chain or limb this spread to anatomically contiguous. You should know anatomy. If you not know, you should read from anatomy first. Anatomically contiguous nooks mean maybe single or can be chain, and then their way of spread is usually anatomically contiguous. You need, if you wanna know, you need to search online, or you can search back from anatomy books. This is anatomy. This need to learn from anatomy. So possible pathogenesis is this is normal lymphocyte transforming event caused by Epstein-Barr virus. This can cause disturbances, loss of apoptosis, and also cytokine protrude. This can cause inflammation response in the body. This tumor escape from immune by protein that can inhibit the cell function, so that they can be escaped from immune. Hodgkin subtype. Classifying Hodgkin lymphoma, you must know. Classify what is Hodgkin lymphoma. Classifying Hodgkin lymphoma. Non-Hodgkin lymphoma classification is just for knowledge or MCQ, because of too long non-Hodgkin lymphoma, a lot of types. I think you will not remember. If you remember Hodgkin lymphoma classification for undergrad level, okay. Non-Hodgkin is, I think you're gonna remember a lot of classification, more than 20 or something. I think you should remember at least these 5. Hodgkin, nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted, and lymphocyte predominant. But this 4, you should remember this 4 only. 1, 2, 3, 4. This is not too common. This is classic 4 type. 1, 2, 3, 4. So what is disturbance? If S in exam, you should explain. You cannot write just disturbance. You should explain. Abundant eosinophilic red color cytoplasm and 2 mirror image nuclei like all eyes. You know all right, this animal.
Yeah. Yes, doctor.
So this animal, similar with this animal eyes, so all eyes nuclei, 2 mirror image. So 2 nucleus face to face like mirror image, surrounded by this clear zone. This is clear zone. This is nucleus. This is nucleus. They are here also the same. Mirror image each other. Mirror image each other, and then pixel, and then perinuclear halo present. This means halo means clear zone. Here also disturbance. First, nodular sclerosis, most common. Characteristic is presence of lacunar cell. This is more similar with lacunar cell. No, not typical cell. This is lacunar cell. So compare with this one. I think for your level and you will forgot just remember lacunar cells more better. You just remember restart cells enough. I think lacunar cell you will forget. This is restart cell. Lacunar cell is like this. Lacunar cell, presence of lacunar cell, collagen bands. Just remember nodular sclerosis. You see lacunar cells and collagen. So the sclerosis means fibrosis. This can produce like here nodule pattern. Prognosis very good. Positive occur in equally frequent in man, woman, age, and then what area? Lower cervical, supraclavicular, and mediastinum. So you can see the chain of lymph cervical, supraclavicular, and mediastinum. So continuous, anatomically continuous like this. In now skin, you can lymph can be at the cervical and then at the inguinal also, like it's not continuous. Here you can see continuous chain, cervical, supraclavicular, and mediastinum. Continuous chain lymph node. In non-Hodgkin example, this can be occurring cervical, another can be inguinal, like totally not continuous, different. Here is chain continuous lymph node involvement. Yeah, you should. If you forgot lacunar cell is multi-lobe nucleus, moderately small nucleoli, clear space. Yes, clear space is called lacunar cell. If you forgot the detail, just remember lacunar cell. But restart cell, you must remember the detailed morphology. Lacunar cell, know the name only. Okay.
Doctor, excellent prognosis means what?
Excellent prognosis. Excellent means you can cure, right? Prognosis very good. You can survive with treatment.
Okay, thank you.
Excellent prognosis means a very good prognosis so that you can survive. You cannot die. And mortality rate is very, very low, extremely low. Another one, miscellularity. Here, this type in miscellularity type, you should know for MCQ. In miscellular type, restart and say classical RS cells are most common in this type. Previously, nodular type is, you can see lacunar cell, quite different from RS cell. Here, typical classical. Here is classical RS cell. Here is classical. Classical RS cell, you can see in this type. Male, most common in male. Previously, nodular sclerosis, male and female equally. Age, most common in elderly. RS cell plus inflammation cell plus eosinophil, plasma cell, and macrophage. Here, disseminated. So, in compare with nodular sclerosis, this type not too go easy to disseminate. So, clinical features. Painless adenopathy. So, you need to do biopsy for definite diagnosis, treatment, radio, chemo. Prognosis. 5 years survival is quite good, more than 90% stage 1, 2A. If 4A or 4B, quite 50% only, quite low now. You can do biopsy like this, needle inject and can take biopsy. You should know, you must know this staging and arbor staging. And arbor staging for Hodgkin lymphoma and non-Hodgkin lymphoma. And arbor, you should know the time also. What staging? Too many staging you will learn later. in Gleason scoring, modifying choose Blum and Richardson, too many staging system for cancer in systemic. Now beginning with lymph node, and Arbor staging is for lymphoma staging. Other Blum and Richardson, another choose modifying choose staging is in colon cancer, Blum and Richardson staging in breast cancer. You will know later. Currently, you need to know.
Doctor, do we need to know the name of the staging and also the explanation of the stage?
Both name and explanation here.
Okay.
Quite easy. This one is much first and then explain. In what stage 1, single, if single for 1, if E means single extra lymphatic organ or tissue is 1E. 2 or more lymph node, quite easy. Same side, diaphragm, same side. It's 2 or this one plus involvement of limited contiguous extra lymphatic organ, 2 or 2E. E means extra lymphatic organ involved, E. If no extra lymphatic organ, this 2 only. 1 also the same. If extra lymphatic organ involved, 1E. 1 means single lymph node, 2 means 2 or more. But should be same side of the diaphragm. 3, both sides of diaphragm. Here you can see stage 1, stage 2. This stage 1, this stage 2, stage 3. You can see this diaphragm, both sides of diaphragm. Stage 4 is quite easy. Metastasis, disseminated, multiple or disseminated. Stage 4 is quite easy. Any stage 4 in the cancer is multiple or disseminated foci into extra organ. Stage 4 is quite easy. You can remember in any cancer. Metastasis, disseminated stage is called stage 4. Stage 3, as explained in what stage 3, extra lymphatic organ, E or both, ES. E means extra lymphatic, S means spleen, 2 SE or 2E, 3E, 3SE or 3E, 2 or 2E, 1 or 1E. E means extra lymphatic organ. 1 means single, 2 double or more, but maybe same side, 3 both sides of diaphragm, 4 disseminated, quite easy. Then you should know A or B. A is quite easy, present or absent. Absent, B means present or what symptom. Systemic symptom like fever, night sweat, and is playing weight loss more than 10%. So this stage 4 staging blast you should know A and B. A being absent, B means present. B present, what symptom present? Fever, night sweat, weight loss. Quite easy staging. So difference, you should know. Here, single Hodgkin. Here, most frequently multiple peripheral. They spread via continuous. Here, non-continuous means they can spread. They are spread cannot occur. For example, cervical should be cervical then spread to supraclavicular. Here, not continuous. Cervical can spread to axilla or something. They can spread any side. Here, but Weber rings. Yeah, I know. We said Weber rings. This ring really involved here or this extranodal and common. Here extranodal common. This ring if you wanna know, you can search from anatomy or later. Around tonsil. So biopsy. Diagnosis, first biopsy. So classes are common in what type? Miscellularity, and common in nodular sclerosis type. So nodular sclerosis type, what cells are common? Previously, recall your memory. I only teach just now. What cell in nodular sclerosis? Hey, anyone?
RS.
RS is miscellularity. IMSC nodular sclerosis.
Cannula conus.
Nodular sclerosis. What cell type? Common. Hey, I already checked now. Miss cellularity ISL. Nodular sclerosis. What cells common?
Lacuna cells.
Lacuna cell. Immunophenotyping. You need to should be 10 to distinguish non-Hodgkin lymphoma from other type of lymphoma and other related conditions. So you should know this for MCQ and OSP. RSA disturbances are positive for CD50 and CD30 in immunophenotyping. This is more important, and I should highlight here. CD50, CD30 positive. So another one, non-Hodgkin. They have a lot of classification. Classified anatomical or can classify into histology pattern, follicular, centrocytic, centroplastic, and immunoplastic. A lot they have classification. AI is WHO, and then you cannot remember this classification, right? This is WHO classification of non-Hodgkin lymphoma. Lymphoid neoplasm. Pre-B, precursor B, peripheral, B and T cell, precursor B, can be leukemia or lymphoma. Precursor T cell can be leukemia, precursor B immature, peripheral B mature. So for you, this I think this table you have better not read because you cannot remember that your level is too high. Even I do this is for this lymphoma quite for me. I need to repeat again and again to remember this classification. I have 10 thesis for this lymphoma, non-Hodgkin. Hodgkin also. So non-Hodgkin lymphoma can be uniform small lymphocytes, or this is follicular, like follicle, lymphoid follicle pattern is called follicular. This is mixed. You can see this small lymphocyte only. This is mixed, big cell and small cell. Age, incident, low grade, high grade. Low grade, rising incident from 30. High grade, peak in children. But after elderly, high grade can occur also. Differential diagnosis of anesthesia is inflammation or can be other tumor, malignant melanoma, seminoma. Hey, seminoma is benign or malignant? I see again. Seminoma is benign or malignant. What tumor then?
What doctor?
Seminoma is benign or malignant, and what organ tumor? First is benign or malignant. Second, what organ? In the body. Eh? Malignant or benign? Anyone?
Malignant.
Benign or malignant? I cannot hear.
Malignant.
Eh? Malignant.
Malignant.
Benign. Who are benign? Who are malignant? Share you benign or malignant?
Malignant.
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 Yếu pa benign or malignant? Ipin. Ipin benign or malignant? She cannot answer. Another one, 4. You benign or malignant? Malignant. Or benign. Pa, you benign or malignant? Pa you share.
Malignant.
What organ?
Testis.
Testis, yeah, testis, malignant, seminoma. Even anyway, they are malignant. Non-Hodgkin incident. But you should remember, I should share for knowledge. Even if low grade, high grade, you think high grade is aggressive, but high grade treatment is usually successful. Treatment is usually successful. Low grade treatment quite difficult. This is a little bit. High grade treatment is more. Low grade is quite difficult to cure. High grade, if you know in time, can cure with some medication. In lymphoma, low grade, even they are slow increasing, but quite very difficult to cure. Like radiotherapy, chemotherapy, quite difficult to treatment. Even sometimes a high grade, even this very aggressive in nature, more easy to cure. Mean more easy to treatment, more response to treatment. Incidence lymph node 65, extranodal 35%. Spread to bone marrow spleen etiology can be discussed. So you should know follicular lymphoma and diffuse large B-cell lymphoma, Burkitt lymphoma. This three types you should know for non-Hodgkin. This three types is enough for you. Other type for your level, no need mental extranodal, no need. You should know Burkitt lymphoma and follicular. Follicular means the cells are like follicular pattern. 40% of NHL. Proliferation of neoplastic lymphoid cells. Slate are larger than other lymphocytes with cleft nucleus. Central sites they call central sites. Nucleus is cleft pattern. This is for MCG what? 14-18 translocation. And BCL2 overexpression. This is MCG1 40-80 translocation is seen in follicular lymphoma. MCG1 you must know. Age attack over than 50. Why important? This follicular can progress to diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma, most common type of lymphoma in attack. When I do this, is I most commonly say this type diffuse large B-cell lymphoma. Diffuse large B-cell. So large means cell began to large cell quite easy and centroblastics. Large centroblastic or immunoblastics. Clinical cause aggressive, but maybe cure. Even aggressive maybe cure sometimes. 50%. Morphology lax cells with prominent nuclei and pan B-cell marker positive. Genetic 40-80 positive. Translocation and BCL. Just remember BCL overexpression. Another one, Burkitt lymphoma is quite easy. I think this lymphoma you teach in immunology or I think you lymphoma teach in immunology or no? I want to know. Lymphoma teach in immunology or microbiology. This type.
Yes.
Immunology also they need to teach lymphoma also. Endemic in Africa caused by because this virus induced lymphoma. Microbiology will teach also. B-cell lymphoma type. Here. Starry sky pattern. A picture present here. Here, the starry sky pattern is point for MCQ. Starry sky pattern, like when you see at night, the star in the sky at night. When you see the starlight, because of reflection and sparkling from the lipid. We get the stars, this pattern, starry sky pattern. When you see under a microscope, this pattern you must know for MCQ. Starry sky pattern. This says when you see under a microscope, it's a little bit look like a star at night. Because of this cancer cell die, they are lipid phagocytes by macrophage, which become like stars, like like stars in the sky. You must know this point for MCQ. Starry sky pattern is characteristically seen in Burkitt lymphoma. Not Hodgkin. You cannot have Hodgkin. Starry sky, but this lymphoma, Burkitt lymphoma type. Genetic mix translocation, mix chain. Chromosome, you can forget. You should remember this chain, mix chain only for MCQ point. Starry sky pattern and mix chain MYC. Cause Epstein-Barr virus, B-cell lymphoma. I think guys, diversity are more common, just no follicular, diffuse large B-cell and Burkitt lymphoma. Okay, extra node mental cell for you, and then not just for knowledge only. You remember follicular lymphoma, diffuse large B-cell lymphoma and Burkitt lymphoma, isn't it? You get pictures. Quite easy. Fever, nice sweat, loss of appetite. Yeah. Pain from drinking even a small alcohol-induced pain. This is quite characteristic in some time. After alcohol, the mechanism is not too sure for that. It's one character of lymphoma. Lymph node enlargement, bone pain, tenderness. This is lymph node enlargement because the lymphoma, lymph node enlargement, bone pain, due to bone metastasis, mediastinal mass, hepatosplenomegaly. You can occur in leukemia, lymphoma, hepatosplenomegaly is quite common. In hematological cases, hepatosplenomegaly occur in many cases, especially cancer. Another one, in RBC disorder, no cancer, other disease associated with hepatosplenomegaly in RBC. What disease? Red blood cell disorder, not cell cancer, other disorder. Hepatosplenomegaly occur in what disease? In red blood cell disorder. Anyone?
Sickle cell.
Sickle cell can be explained. Okay, it's quite correct. Another one, very common and important topic for RBC. Very common disease, and then this can present with hepatosplenomegaly in RBC disorder. What is this? Very common in Malaysia.
Thalassemia.
And thalassemia. Hepatosplenomegaly is quite common because thalassemia is extravascular or intravascular hemolysis.
Extravascular.
Yeah, extravascular. So the hepatosplenomegaly present. Intravascular usually no hepatosplenomegaly. For example, GCSPD no hepatosplenomegaly usually. Blood transfusion hemolysis intravascular no hepatosplenomegaly. कैसे क्या नहीं? So biopsy, genetic, hematology, NNA. What is NNA? I think you should know from RBC. What is NNA? What is AIH? You already learned from.
What's your question again, doctor?
Hey, yeah, what is NNA and what is AIH? This only. What is NNA? What is AIH?
Hemolytic anemia, autoimmune hemolytic anemia. Autoimmune.
Yeah, this one. What is NNA?
Forgot lah, doctor.
What anemia? NNA. MHA. What is N? What is N?
Nomochromic, nomocytic.
Yeah, nomochromic nomocytic anemia. They can present with pancytopenia because they can suppress bone marrow cell and can cause pancytopenia. If lymphoma cell can be sometimes present in peripheral blood, sometimes only usually they can see in bone marrow or lymph node only. I have done a lot of too many cases, this is for blood. I take all blood sample from lymphoma case. I can see atypical lymphocyte only in blood film. I can see they have malignant structure in bone marrow and lymph node only, biopsy only. Peripheral blood lymphoma say I haven't seen when I did for this, I haven't seen lymphoma say peripheral blood. From my experience, quite rare. They can see mainly in lymph node or bone marrow. Sometimes they can see sometimes if this can show focal involvement, but quite rare. Blood chemistry, hyperuricemia. Why hyperuricemia causes in malignancy? You should know that because of cancer, a lot of malignancy are produced. They die. They produce protein, then uric acid. So hyperuricemia can occur in many malignancy. Abnormal lymphadenopathy test. They can suggest disseminated disease, and LDH is also raised in here. If cell lysis, LDH is raised only. Also depend on this staging, nodal extranodal involvement, treatment, palliative chemotherapy, radiotherapy. Another one is metastasis. Metastasis secondary is more frequent than primary tumor. Primary tumor lymphoma is even not too frequent. Metastasis from other tumors is very common. For example, carcinoma, melanoma, sarcoma, they can spread to lymph node. You can see here abnormal structure inside the lymph node. Lymph node should be normal structure like this. Lymphoid follicle, this is normal structure. Here you can see abnormal structure. The glands and abnormal structure in lymph node. This is metastasis. So I will continue with plain disorder. So from this topic summarized, Hodgkin lymphoma, you should know at least mixed cellularity and nodular sclerosis. Here where is lymphoma definition, Hodgkin lymphoma classification, and you should know ISA explain nodular sclerosis types and mixed cellularity types. These two types you need to know, and Hodgkin classification no need. Just no follicular, 3 type follicular, clavicular B-cell, bucket is enough. So lymphoma this need to know. And clinical features. Diagnosis is quite easy if you know the format in hematology, the same blood film, bone marrow, cytogenetic, flow cytometry, immunophenotyping, this all blood chemistry. This you need to write down your own format. In hematology, more leukemia, lymphoma format is the same only for diagnosis. Metastasis is just for MCG. So I will continue with bleeding disorder for one because of Wednesday I have meeting. I have not much time Wednesday. You can see, right? Bleeding disorder. So according to the learning outcome, you should know INTP, hemophilia, von Willebrand, DINC. This three is important according to the learning outcome. So where is homeostasis? I already explained in the homeostasis chapter. So begin with bleeding disorder. Bleeding disorder can be caused by two causes. Hey, now I see the list too many. really too many. I think around about 10 students, and now more than 28. You got a lot. Too many. If you are connection, sometime only you can delete your name. But I no, too many. Because I saw now how many students? 68, 67. If it's okay, you can just your connection are not good. You need to later I will tell Dr. Jeka, and then you should. You also need to tell later if I talk with her first. If necessary, you need to send message to her also for your connection problem. Complain. Otherwise, we need to decide for what online method we have to use. So this student, five also include, right? As in 5G. 5, why you have problem or not? 5, I saw you every time. But I think you have not much problem, I think.
I did have problem. I got disconnected several times. I need to rejoin.
Oh, because I saw you every time. You never absent, so 5 is no problem. Because 5 always absent, always present. 5 always present. And I think Pan have no problem. No problem. You can submit your. Otherwise, if you have problem, you will be you lose your maths in exam. If online if time limit depends on time limit. See your connection okay or not? See
Yes, doctor.
Your connection is okay.
Sometimes not okay.
Yeah. Sometimes not okay. Still possible. We can try it, but I think should be considered for some method. If you too many students, I need difficult to do online exam. I need to choose other ways. Timing, especially timing. If I give 1 hour limit, if your connection is slow, you cannot finish in time. For example, one MCQ we give usually 40 seconds. 40 seconds, after 40 seconds, another question change only. You cannot repeat that. And you cannot honestly redo it again also. When you answer A, you already submit and you are already key in A. Your max, you cannot do correction again also. So continue with bleeding disorder. Main problem is antibella who hand they are very serious problem. Revamp. J also sometimes got problem. J, where is J? J. Tanusha. Shafi's problem, yes. Komati. Where is Komati? Komati today not attending.
Doctor, I'm here.
COVID. So bleeding disorder can be 2 types. Shortly or here can be caused by vascular defect. Anyone please mute your microphone, I'm too noisy. So can be caused by vessel defect, platelet defect, and coagulation defect. Here is the table. Bleeding disorder can be caused by vessel, so you can cause bleeding by vessel defect or platelet defect or clotting defect, or another one is DIC. DIC means disseminated intravascular coagulation. I already teach for some chapter in thrombosis and embolism lecture. So K, I already explained K particular in general pathology. Depends on size. Heme arthrosis. Here you should know. Heme arthrosis. Bleeding into the joint. Hematoma. Hematoma inside the body, hematoma outside the body. So you can see vascular and platelet disorder. Bleeding in what area? Mucous membranes and into skin. So mucous membrane, where? Mucous membrane bleeding. Example, please tell me one example of mucous membrane bleeding. Mucous membrane bleeding. Example, please give me one example, two example. Mucous membrane bleeding. Anyone? And skin bleeding. What is skin bleeding? So anyway, why not answer? Please answer my question. Why so sad? Are you sleeping, Shen? You can brain bleeding. Example. Where is the membrane in the body? Example.
Nosebleed.
Yeah, nose bleeding, correct. It's mucous membrane bleeding. Epistaxis. You should use the term epistaxis. You are a medical student, so you should use the term. Nose bleeding is layman term. You should epistaxis. Skin bleeding is quite easy. What is skin bleeding? Skin bleeding. Bleeding, you can understand my question. What is bleeding into skin? Example, the term. This skin bleeding very easy. Why are you so silent?
It's like cut.
Huh?
Skin bleeding, right?
Yeah, what?
Ecchymosis.
Yeah, pedicure, papura, they are all skin bleeding also.
Okay, papura.
They are one type of skin, and one type. You can see under skin, right? Joint bleeding is joint soft tissue, usually occur coagulation disorder. So you should know that bleeding time, PT, ABDT, PT, platelet count, prothrombin time. You should know ABDT. If you wanna test extrinsic pathway of clotting system, prothrombin time, intrinsic pathway, ABDT, extrinsic pathway, PT, platelet count, and bleeding time. This general test for bleeding disorder. This is pathway. Intrinsic pathway, extrinsic pathway, common pathway. And then this is what usually common pathway we usually don't consider. Usually we consider extrinsic or intrinsic. During first vascular abnormality, can be congenital or acquired. Inherited or acquired. Inherited can be hereditary, hemorrhagic, telangiectasia. I think this hemangioma I already discussed in childhood tumor. Hereditary, hemorrhagic, telangiectasia is here. You can see present with epistasis telangiectasia, multiple. Here you can see Rex box in oral cavity, finger, nose. This can present visceral also. They have family history. They can present with this small top like telangiectasia, top about epistasis. This is called hereditary hemorrhagic telangiectasia. For MCQ point, this is for MCQ or can be S by or SP or sometimes also. This is usually genetic. This Ehlers-Danlos syndrome is also hereditary, quite abnormal collagen. Representation, papura and superficial bleeding. So this is vascular defect, platelet defect, usually superficial bleeding. Skin, you guys memory. Here another feature, hyperelastic skin. Fine, your skin can do like that. Fine.
No, doctor.
You can do like this. Anyone who can do like that? Fazin or here? Fazin absent today.
Alif, doctor. Alif can. Alif can.
You can do this. Shan, you can do as well. Shan. Hashan. Hashan can do like this. Hyperelastic skin. Plus abnormal bleeding. This acquired vessel disorder can be child abuse. Can be caused by vessel inflammation, inosolium purpura or vitamin C deficiency, steroid-induced purpura, or varices or senile. You should know this senile purpura. In elderly patients, they have purpura you can detect on their body due to atrophy of supporting tissue. Child abuse, some child come to clinic with like bleeding, you should consider child abuse also. Acquired can be UV-like or infection or neuroplasm or drug or allergy. This is caused by infection, penicillin allergy, and contact dermatitis. So, please disorder due to platelet now. First vessel finished. Second vessel you should know HH, hereditary hemorrhagic telangiectasia is you should know. Another one is Ehlers-Danlos syndrome. Bleeding disorder second caused by platelet. Platelet causes are more important because of platelet more common in the clinic. In compare with vessel cause, you must know the base platelet and coagulation. Is vessel cause the second line. So this topics caused by platelet disorder is important. Caused by quality or quantity. Quantity can be caused by dilution effect or decreased protection or increased testosterone. Quality caused by genetic. Dilution effect is here or etiology. Quantity. Why quantity reduce? First, cannot produce from bone marrow. Second, produce bad testosterone, that immune. Or non-immune can be because HUS, TTP, and DIC is non-immune testosterone. This is immune SLE, immune. This can cause ITP. This can cause immune testosterone. Hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, and DIC. You will know this time later, no problem. ITP, idiopathic thrombocytopenic purpura. This time, all you will know later, DIC, TTP, HUS. Sequestration, spleen, testosterone increase. Another one, dilution, massive blood transfusion. Blood transfusion, because platelet After fresh blood only, this can contain platelet. After they store in 4 degrees Celsius, platelet already destroyed. So if blood transfusion, if not fresh blood, you can cause thrombocytopenia later if many transfusion. Because this blood you transfuse, but no platelet in the blood. This can cause dilutionate effect. So understand this mechanism can be caused by destruction or reduced production or destroyed by spleen. Due to reduced production can be this cause. Congenital cause is usually quite rare. You should know acquired cause. Virus, radiation, chemo, PNH, plastic, and MDS. This all can cause reduced platelet count. Immune can be caused by this immune, non-immune, this one. So I will begin with ITP. My topic ITP, not. Wait a minute, and search ITP. So I will addition here ITP, and I will share slide again. Desktop. ITP, idiopathic thrombocytopenic purpura, usually caused by immune-mediated destruction. Anti-platelet antibody occur here. ITP is much new topic. This ITP you will teach again in pediatric posting also. ITP is much new in internal medicine and pediatric. ITP is much new topic. You will see frequently in clinical. ITP is much new topic. You must know ITP. Caused by immune because of anti-platelet antibody occurs. Their features isolated thrombocytopenia. There is usually no clinically apparent associated condition here. Can be classified acute, chronic. Chronic means more than 6 months is called chronic. So this is different between acute and chronic. Acute age children, here you can see. Chronic attack 2040. Female may it acute saying chronic female common. Adolescent infection, antecedent infection means before this ITP, viral infection followed by ITP is common in children. Onset platelet count less than 20,000, here less than 50,000. Duration long term, more than 6 weeks. This is spontaneous remission means they can cure without treatment. This is they cannot cure without treatment. Spontaneous remission means they can cure without treatment also. So pathogenesis is quite easy here. After viral infection, antibody IgM directed against platelet worker, and then this platelet coated antibody coated platelets are phagocyted by immune system, and this can cause platelet destruction here. Viral infection cause produce antibody. This antibody are coated in platelets. These platelets are destroyed by immune system. This can cause thrombocytopenia. Clinical features can be sudden or can be slowly. Presentation, petechiae purpura area here. Extremities of buttocks, mucosal bleeding. Epistaxis, hematuria, menorrhagia, GM bleeding. These are all mucosal bleeding. Rarely, intracranial hemorrhage can occur. Diagnosis, quite easy history, examination, bleeding purpura, and size of spleen, normal here. Investigation quite the same like other hematology. Full blood count, they can see low platelet count because of platelet destroy. Microscopic finding, platelet are normal size or sometimes larger. Others normal. Increased bone marrow, megakaryocyte. Coagulation test prolonged bleeding time because platelet deficient, and PT and ABDT. ABDT. PT and ABDT is normal here. Because this is platelet effect, no coagulation effect. So here you can see again, PT, ABDT is abnormal in this disease. Bleeding time abnormal in thrombocytopenia, platelet count. So you can see here prolonged bleeding time only, normal PT and ABDT, because this is not coagulation effect. So I will stop here. Tomorrow we'll continue. Today for the bleeding disorder, in summarize, most important for today's class is for bleeding disorder is ITP, most important, must know. And you need to classify also. Okay, I will continue tomorrow morning.